Tubular maximum and renal threshold in regard to glucose by Chrissy Wilhelm. The urinary system is a vital component of the human body responsible for maintaining internal balance or homeostasis by regulating the volume and composition of body fluids. It consists of kidneys, ureters, bladder, and urethra. One of its primary functions is the elimination of metabolic waste products such as urea and creatine, while conserving essential substances like water, electrolytes, and nutrients. Through the process of urine formation, the urinary system helps control blood pressure, electrolyte levels, and pH balance. At the core of the urinary system are the kidneys, which play a central role in filtering blood. Each kidney contains millions of microscopic structures called nephrons, which perform the work of filtration, reabsorption, and secretion. Blood enters the kidneys through the renal arteries and is filtered by the glomerulus of each nephron. Substances that the body needs, such as water, sodium, and glucose, are selectively reabsorbed into the bloodstream, while excess or waste substances are excreted as urine. This selective reabsorption ensures the body retains essential nutrients and maintains chemical balance. Under normal conditions, glucose is completely reabsorbed by the renal tubules and does not appear in the urine. This reabsorption occurs primarily in the proximal convoluted tubule of the nephron. The presence of glucose in the urine, known as glucosuria, typically indicates that blood levels have exceeded the kidney's ability to reabsorb. This phenomenon is often associated with uncontrolled diabetes mellitus and highlights the importance of urinary system in monitoring and maintaining metabolic health. What is tubular maximum? Tubular maximum, or TM, refers to the highest rate at which the renal tubules in the kidneys can actively reabsorb a specific substance from the filtrate back into the system. Each substance that the kidney reabsorbs, such as glucose, amino acids, and electrolytes, has a specific TM. This maximum capacity is determined by the number and activity of carrier proteins responsible for reabsorption in the nephron's tubular cells. When the filtered load of the substance stays below the TM, the kidneys can reabsorb nearly all of it, preventing any loss in the urine. For glucose, the tubular maximum in healthy adults is approximately 375 milligrams per minute. This means that the kidneys can reabsorb up to 375 milligrams of glucose per minute. If blood glucose levels rise too high, as often occurs in uncontrolled diabetes mellitus, the filtered load may exceed the maximum rate. When that happens, the carrier proteins become saturated and any excess glucose that cannot be reabsorbed remains in the filtrate and is excreted in the urine. This condition is known as glucosuria and is an important clinical indicator of elevated blood glucose levels and suggests that the renal threshold has been surpassed. What is the renal threshold? The renal threshold for glucose is defined as the plasma glucose concentration at which the kidneys can no longer reabsorb all the filtered glucose, resulting in the appearance of glucose in the urine. Under normal physiological conditions, the kidneys effectively reabsorb glucose and filtrate back into the bloodstream through specific transport proteins in the proximal tubules. However, this reabsorption process has a limit. Once the blood glucose levels rise above a certain point, the transport proteins become saturated and the excess glucose begins to spill into the urine, a condition known as glucosuria. This threshold can vary slightly among individuals based on factors such as age, kidney health, and individual differences in tubular transport capacity. A renal threshold lower than average may indicate early signs of kidney dysfunction or decreased reabsorption capacity, while a higher than normal threshold may sometimes be seen in people with long-standing diabetes due to adaptations in the renal tubules. Detecting glucose in urine is often one of the first signs of hyperglycemia and can be a useful diagnostic tool in conditions like diabetes mellitus. Monitoring the renal threshold and understanding its role in glucose handling is important for early detection and management of metabolic disorders. Diabetes mellitus and glucose in urine. Diabetes mellitus is a chronic condition in which the body either does not produce enough insulin, which is type 1 diabetes, or cannot effectively use the insulin it produces, which is type 2 diabetes. Insulin is a hormone that helps transport glucose from the bloodstream into cells, where it is used for energy. Without adequate insulin function, glucose accumulates in the blood, leading to hyperglycemia. Over time, as blood glucose levels continue to rise, they can exceed the kidney's ability to reabsorb the glucose, surpassing the renal threshold. When the blood glucose concentration exceeds the renal threshold, the glucose transports in the kidney tubules become saturated and cannot reabsorb the filtered glucose. As a result, the excess glucose is then excreted in the urine, a condition known as glucosuria. The presence of glucose in the urine is a key factor, an indicator of poor blood glucose regulation, and is often one of the earliest signs of uncontrolled diabetes. Regular monitoring and management of blood glucose levels are essential in people with diabetes to prevent glucosuria and its potential complications, which include dehydration and damage to the kidney function over time. The clinical significance of this is that glucosuria, or the presence of glucose in the urine, is a clinically significant marker that indicates hyperglycemia, a condition characterized by elevated blood glucose levels. Under normal circumstances, glucose is completely reabsorbed in the kidneys and does not appear in the urine. However, when blood glucose levels rise above the renal threshold, the kidneys are unable to reabsorb the glucose, resulting in its excretion in the urine. This makes glucosuria an important early warning of abnormal glucose regulation. The detection of glucosuria is commonly used in the diagnostic and monitoring of diabetes mellitus. It often prompts further testing of blood glucose levels and hemoglobin A1C to confirm the diabetes diagnosis. In patients with known diabetes, the presence or absence of glucose in the urine can help assess the effectiveness of the treatment and overall glycemic control. Persistent glucosuria suggests that blood glucose levels are not very well managed, increasing the risk of long-term complications such as neuropathy, retinopathy, and nephropathy. Effective management of blood glucose levels is essential in preventing the renal tubular maximum from exceeding. When glucose levels are kept below the renal threshold, the kidneys can perform their reabsorption functions properly, minimizing the risk of glucosuria and protecting the kidney function. Maintaining good glycemic control not only reduces the symptoms of diabetes, but also preserves kidney health, reducing the risk of diabetic neuropathy and chronic kidney disease over time. So to summarize, understanding the concepts of tubular maximum, or TM, and renal threshold is essential when exploring how the kidneys manage glucose and how these processes are affected in conditions like diabetes mellitus. The tubular maximum represents the maximum rate at which the renal tubules can reabsorb the substance from the filtrate, such as glucose. In healthy individuals, this value for glucose is approximately 375 milligrams per minute. As long as the blood glucose levels remain below this rate, the kidneys effectively reabsorb all the glucose and none is lost in the urine. The renal threshold refers to the plasma glucose concentration at which glucose first begins to appear in the urine. When blood glucose levels arise above this point, such as uncontrolled diabetes, the reabsorption capacity of the kidneys is overwhelmed and glucose spills into the urine, a condition known as glucosuria. The appearance of glucose in urine signals the body's regulation of blood sugar is impaired and that the kidneys can no longer compensate. Together, the tubular maximum and renal threshold help explain why glucose is found in the urine of people with diabetes and are important indicators of kidney function and glucose regulation. Understanding these processes allows healthcare providers and patients to better manage diabetes by aiming to keep blood glucose levels within a safe range, thereby protecting kidney health and overall metabolic function. For more information, you can check out this resource. Thank you for watching.